So my name is Panita Tandon. I'm one of the hepatologists working at the University of Alberta Hospital, and we're in the Ziegler-led Core Centre, which is where we run the portal hypertension clinic, and that's a clinic for chronic liver disease failure patients run by myself, Michelle Carbonneau, who's a nurse practitioner, and Jaya Ramamurthy, who is our dietitian. So the clinic was established in 2009 in order to serve the needs of patients living with chronic liver disease, and as a result of close follow-up of these patients, we've managed to decrease hospitalizations and decrease stay in hospital, and hopefully improve the quality of life of these patients, increase empowerment by educating them, and allow them rapid access to care.
My name is Michelle Carbonneau. I'm the nurse practitioner for the clinic. Our clinic opened in March 2009, and it was developed to try and provide more intensive care for patients with cirrhosis, and particularly for those ones that have more serious complications like fluid buildup on the belly and those that might need a liver transplant. So prior to the clinic opening, these patients were sort of left between emergency and trying to get in to see physicians when they could, but now that they have access to us directly through the clinic, they're able to call us when they have symptoms. We can get them in for urgent outpatient procedures and avoid that whole emergency hospital admission loop if possible.
My name's Wade. I got diagnosed with liver problems. Roughly, I just wasn't feeling good, and then my one doctor did blood work, and then from there he sent me here, and then I stayed for 3 months. So I was in the hospital for 3 months, and even after all my treatments, I get to go home at the end of the day, which I'm lucky. Lots of people don't. So.
Well, she just told me that if you don't have a liver transplant, it's like life-threatening.
Well, I'm dying, so it's all good. No, but there's no cure for me. So, but the weird thing is, this transplant that they did for me, it worked for somebody else. Just because it didn't work for me, it went to somebody else, and it's perfect. And I'm good with it.
So how is your quality of life now because of this clinic?
Well, if it wasn't for this clinic, I couldn't even watch football games and stuff. So I'm quite content.
You're happy with that. What kind of things do they get you to do? What do you have to do? What do you have to watch a lot?
Basically, the biggest thing I can tell anybody is your diet is huge.